The foundation of the referral capture process is really delving into the policies and procedures of the organization's 340B program. How the covered entity defines a 340B eligible patient dictates how their referral program will operate. The 340B statute prohibits covered entities from providing 340B drugs to patients that are not patients of the covered entity. Beyond that, it didn't provide a whole lot of detail around the definition of a patient. HRSA provided further guidance on patient definition in 1996. The elements for a 340B eligible patient provided in this guidance are that the patient receive care from the covered entity documented in the covered entity's medical record. That care needs to be provided by a healthcare professional that is either employed or contracted by the covered entity or under another arrangement with the covered entity, such as a referral. The third element is that the care provided is within the scope of the covered entity's grant. Now, this only applies to grantee covered entities, but it does define the locations and types of services that fall within the scope of the 340B program. The last element that this guidance provides around patient definition is that an individual is not considered a patient of the covered entity for the purposes of the 340B program if the only care that they receive from that covered entity is the dispensing of a medication. Thinking about these criteria, we work through the policies and procedures for each covered entity to determine what specific documentation needs to be demonstrated within the medical record for that covered entity to consider a patient to be eligible within the scope of their 340B program. For some covered entities, this means looking for a primary care visit with the covered entity within the last 2 years and documentation of the medications the patient is on, including those not prescribed by the covered entity. Some covered entities choose to limit their definition of the responsibility of care for referral prescriptions to only include those where they have documentation in the medical record, including a formal referral out to the specialist, as well as a note back from that specialist provider that's then stored back in the covered entity's medical record. Other covered entities elect to take a more broad approach to defining their responsibility of care when it comes to referral prescriptions. We work with covered entities when updating their policies and procedures to make sure that the definition that is created is in line with the 1996 patient guidance, and that we're creating a process that not only falls in line with the program intent and that 1996 guidance, but also now aligns with the covered entity's policies and procedures.